still to this day, a lot of the calls that we receive think the only way to ingest cannabis is via smoking. And so the stigma of smoking is there. And so can you talk about, like, how am I supposed to get my daughter, she's 4 and she's autistic, and she can't smoke. And so you have to go back and do you receive those type of questions as well?
Oh, all the time. And, and I find that once you educate people and they realize that there is such a thing as targeted medical use, where you're individualizing a protocol, you're relying on what the research supports for their specific situation or condition. It's a very different approach. I don't ever have a patient call me and pay for a consultation so that they can get higher or more intoxicated. That just doesn't happen. There is serious medical use. And then I counter that even those that are inhaling or using adult use or recreational are still receiving medical benefits. And there was a retrospective study done on cannabis smokers that have been using cannabis through inhalants only for 20 years, and they had like an 80% less instance of diabetes. So even if somebody is just using it recreationally, they're still kind of self-medicating, and they're still receiving some benefit from that. But for really targeted, serious medical use, I very rarely recommend inhalants. It's usually tinctures, sublingual tinctures, or concentrates or topicals, something of that nature, where it's, the focus is not the intoxicating effect. Although inhalants can be very useful, and I have taught my daughter to use a vape pen, we only use it for emergency rescue. So there are days still when she struggles with severe PMS and migraines, and you can see her ramping up in some behaviors. The vape pen will stop it in its tracks. And, we've taught it to her as her straw, and there are days that she's really fighting to maintain control, and she'll say straw, and we run for it because it's just so quick. Sublinguals are 10 to 15 minutes, which if your child is struggling to maintain control, that can feel like a really long time. Not everybody, but it is a tool.
Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at Patients Group and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.